Thank you, Angel. 5 on your health this morning, a new look at lung cancer. It is still the top cause of cancer-related deaths in the U.S. for both men and women. And now researchers are learning more about the risks, especially for people who've never smoked.
Here to explain is Dr. Jeff Yang, a thoracic surgeon at Mass General Brigham. Doctor, thank you so much for making time for us this morning. We've known for a long time that smoking is the leading risk factor for lung cancer. What else is on that list?
Thanks for having me. Other risk factors include radon, so this is a gas that seeps from soil and often enters into houses, and then occupational exposures such as silica, asbestos, diesel exhaust. And we're learning that air pollution matters more than ever, so PM 2.5 and fine particulate matter. People with prior lung disease, and also if you've had radiation to the chest before, for example, from lymphoma or breast cancer treatment, that can also elevate your risk of having lung cancer.
Anyone can buy one of those radon testing kits online or at the hardware store. Should I call the doctor if the level is high?
That's correct. So if your level is above 4 picocuries per liter, it's important to try to fix what's going on in the home. And I think it's important to discuss with your doctor, especially if you feel that you've been exposed to radon for several years.
Let's say I don't get a CT scan of my lungs, say. Are there other ways to catch lung cancer early?
So unfortunately, there isn't. So with early stage lung cancer, there's often no symptoms. And so in that type of situation, really the best way to find lung cancer early is through a quick and easy lung cancer screening scan. It only takes about 2 minutes. It's quick, easy, it's painless, and it's covered by insurance here in Massachusetts, fully covered, so it's free. But other symptoms to look out for, if you don't have that CT scan, but other symptoms to pay attention to would be a cough that doesn't go away, if you're coughing up blood, if you're having unexplained weight loss, loss in appetite, feeling fatigued, or having chest pain. Those are all also important symptoms to pay attention to.
You mentioned a lot of things here. What about like secondhand smoke, if you're around that, or fires, if you're working a fire or at a fire scene for a long period of time?
Absolutely. Those are really important risk factors. Secondhand smoke, long-term secondhand smoke. I've had patients who have had lung cancer just because of that. And also, it's important to know that firefighters, they do have elevated risk of getting diseases because of the air pollution that they breathe and the fine particulate matter we're talking about. So there's actually a study of firefighters here at Mass General where we're trying to figure out whether or not firefighters are having elevated risk of lung cancer.
Thank you, Dr. Jeffrey Yang, a thoracic surgeon at Mass General Brigham. Thanks for joining us.